China's large population of 1.4 billion people is one reason the country applied the dynamic zero-COVID policy in the past 3 years. China has a large population, but medical resources per capita are not sufficient. Such a large population base, multiplied by the sudden rise of early cases, means a lot of pressure on China's medical system. According to data released by the World Bank, in upper middle-income countries like China, the average level is 2.12 physicians per 1,000 people. However, the ratio in China is 1.98, lower than the average level of such countries and far lower than the average level of 3.1 physicians in high-income countries. Another reason for applying the dynamic zero-COVID policy is China's policy priority of putting people first and putting people's lives first. Since the outbreak of COVID-19, especially at the initial stage, the risk of severe illness and death rates are so high. So China followed science and took swift and decisive actions to contain the spread of the virus, to limit the number of infections and save lives. Estimates from the World Health Organization show the death toll associated directly or indirectly with the COVID-19 pandemic between January 1, 2020 and December 31, 2021 was approximately 14.9 million globally. China's death toll in 2020 was 4,634, with only 2 more deaths in the year 2021. The stringent dynamic zero-COVID policy and measures have not only effectively contained the virus spreading, but also bought time for the country and the world at large in terms of getting better prepared, vaccine development, and distribution. In the past 3 years, China had been pushing for vaccination and building an immune barrier. According to the latest official data, China has administered over 3.4 billion doses of COVID-19 vaccines nationwide, with over 90% of its 1.4 billion population fully vaccinated. Over 87% of people over the age of 60 are fully vaccinated. Meanwhile, China has rolled out second booster shots. The country's CDC has also been monitoring COVID variants. China is also adapting and optimizing its COVID-19 response measures to the new developments in the pandemic to better coordinate epidemic response and socio-economic development.
The virulence of the pathogen has decreased significantly, and the level of active immunity of the whole Chinese population has improved significantly, with vaccination of the elderly and high-risk groups reaching a necessary threshold. The country has also prepared medical resources, including medicines and treatment resources for critical cases. All these have contributed to the country's adjustments of its COVID policies and measures.
So exactly because China's 3 years of strict measures have led to a higher vaccination rate, lower death rate, decreased virulence, and better understanding of the virus, China was able to finally shift from the dynamic zero-COVID policy to more relaxed measures and reopen its borders.